coping with it.
Right, I'm sure
it is on ground.
That's very correct. You're also president-elect of the Nephrology Association of Nigeria. Are you the president now?
I am the president.
Wow. So many presidents hang on your neck right now. So you must be wearing like not double crowns, but 3. So to say.
Yeah.
Right. Okay, which is very, very good. It's very rare to come across specialists like you, Professor Awobusuyi, nephrologist. So for those who do not understand us, who are those referred to as a nephrologist?
Well, nephrologists are doctors that specialize in the care of kidney disease. We treat kidney diseases in various forms.
Okay.
That's the medical aspect. We also have urologists who are the surgeons, but we take care of the kidney diseases, the medical aspect of it.
So you guys treat anything that relates to kidney. That's why you're called nephrologists.
Yes.
All right. The nephrons, is that a part of the kidney?
Yeah, that's the filter of the kidney.
Oh.
That's the part of the kidney that filters blood and for it to be processed into urine, for the waste products to be extracted from blood. So that's the part.
Okay. All right, we'll talk much more about that and the process of all of this works. But do you have many of you around in town?
Yes, we have, well, not enough though, but appreciable number of nephrologists. In the country, we should be getting more than 200 or thereabouts. 200?
To a population of over 200 million? Is that sufficient?
No, definitely not.
It's not?
It's not.
Okay. We'll try and see what we can do to, build capacity in this regard. But yesterday was World Kidney Day. Let's talk about that. What's the significance of marking a day like that, Prof?
Well, thank you, Victor. The World Kidney Day is an international day that is celebrated all over the world. And this year's one took place yesterday. The importance is that it's a day that we bring to the notice of individuals all around the world, to enlighten them about the importance of our kidneys and the fact that we must take care of our kidneys. Kidney disease is very common. It's really, really common.
How common?
On the estimate, if it's about 10 to 12%. That's in terms of prevalence. In terms of so if you take 100 individuals, about 10 to 12 of those individuals
are likely going to come down with a kidney disease.
Yes.
All right.
Would have had
one kidney infection.
Kidney disease. We are looking at kidney disease that's been going on for a long time, for some period of time. A minimum of 3 months by definition.
Right.
And the issue is most people don't even know
that they have it.
They have it.
All right. So if we were 10 in this room, you're saying now that at least one person would likely have a kidney disease or would have come down with a kidney infection at one point or the other. Yeah. Is that what you're saying?
Precisely.
That means it's a serious public health problem.
It is, and it's a growing concern because the prevalence is increasing all over the world, and we are very much concerned with it. We are concerned.
All right. So let's dissect all of this down and break it down for our listeners this morning. We're talking about the kidneys. Some people might not even know what we're really referring to. So what organ in the body is the kidney, Prof?
Yeah, our kidneys are two bean-shaped organs located at the back of our abdomen. It's the organ that removes waste products from our bodies and also regulates a lot of things in our bodies, such as our blood pressure, for instance. It's an organ that produces what stimulates bone marrow to produce blood. It's an organ that manufactures the active form of vitamin D that stimulates, sort of makes our bones strong, enhances calcium absorption from the intestinal, intestines.
Right.
So it serves a lot of functions to keep us healthy.
So to ask the question of its significance, to our survival as human beings, how would you describe it?
Yeah, it's very vital. It's very significant. It's an organ that takes about 25% of blood that our heart pumps every single minute, to show you how important this organ is.
25%?
Yes.
Of the blood that's pumped?
Yes.
Goes through the kidney?
Goes through the kidney.
So it's pretty serious then?
It's important.
Wow.
Because if it doesn't do its work, in no time, the person would not function
effectively. So the big question now is, can I survive without a kidney?
Absolutely no.
Without any? Okay, but can I survive
with treatment?
So if I have just one, if one goes bad and one is functioning, can I still survive with that?
Yes, you can survive. And that's the basis for kidney transplantation. We can live with just one single kidney and live perfectly well. There are people born with just one.
You mean it?
Yes.
That's an abnormal situation.
It's abnormal, but it doesn't. They don't have a reduction in their lifespan, and they live.
They can survive up to 80 years, 90 years,
90, whatever age that God wants them to survive.
Right.
And they can live a very active life, even run and participate in strenuous things like going for Olympics. We've seen
that kind of situation before.
Yes.
That's good. So how do kidneys work, Professor Awobusuyi? How does it work?
Our kidneys work by, let's say, filtering blood that comes to it, and that's the glomerulus. That's let me use the word front part of the kidney.
Okay.
So the first thing is filtration. So the glomerulus filters. It's like a sieve. You are removing. Let me use an analogy.
Mm-hmm.
If you are conversant with the process of making gari or cassava,
mm-hmm.
and you now press that initial pressing that they do, and something comes out of that sac.
Okay.
So there's some kind of pressure generated by the blood pressure of the individual.
Okay.
On that glomerulus, and that forces, it's not water precisely, it forces fluid. We call it that's some filtrate.
Okay.
So into the other parts of the nephron, as it is called.
Right.
The nephron is the functioning unit in the kidney. So as that fluid moves through the nephron, it's processed. The useful constituents of that fluid are removed, and the wastes are allowed to move through and passed as urine, that were passed with the urine. Some other substances are also secreted into that fluid as it moves along the nephron. So those other constituents that the body that are also wastes are also secreted.
Right.
Apart from removing waste from our body, the kidneys also helps us to control the amount of water in our body. If you have a friend, for instance, that takes a lot of drinks. You see that they go to toilets to urinate frequently.
Right.
And that's because the kidneys remove fluid, from the body.
Okay.
It also helps.
So, but if he's doing that, does that mean he's having a bad kidney?
No, that means it's good.
Okay, it's good. If he goes to urinate frequently.
Yes, because now he's taking a lot of water, much more than his body needs.
Okay.
And it's the duty of the kidneys to remove the excess. And and that's what it's doing.
So can one liken the kidney to a treatment plant that removes waste from the house?
It's more than that.
It's more than that. But it's doing that kind of function as well.
As one of the functions.
All right. All right. Professor Jacob Awobusuyi, I know that for some parts of the body, the more you advance in age, the more they somehow depreciate in functionality. So does it really affect our kidneys?
Yeah, it does. The more we get, the older we get, the more the function of the kidney somehow reduces, and you can't compare the functionality of an 80-year-old man with that of a 30-year-old man. So there is some degree of reduction
as one ages. All right, then. Lagos Traffic Radio on 96.1 FM. If you're wondering who I'm speaking with, I have Professor Olugbengba Awobusuyi. He's a consultant nephrologist with the Lagos State University Teaching Hospital. We're reflecting on World Kidney Day, which was marked yesterday, but majorly we're trying to pay attention to our health, trying to stay healthy by having you have a better knowledge of how the kidneys work. Very shortly, I would open the lines so that we can expand that discourse beyond the studios to also have your input. But let's get back to the roads. Let's still look at some other locations right now. The flash update coming in from the Lagos-Ibadan Expressway. I understand there's a fallen granite. Fallen granite from a truck at the toll gate. This is inwards motorways. It has affected the flow of movement around that particular corridor, and backlog is now somewhere around corn oil. All right, so we have something falling from a truck, talking about granite. That's at the toll gate. That's on the Lagos-Ibadan Expressway, inwards motorways. So you need to pay attention to that as you drive through that corridor. I'm sure Shulato and others will be keeping us posted on the latest with that as well. Okay, so if you're making that journey to the island, we did talk about good movement within the Third Mainland Bridge at this time. Still looking good. Ikorodu Road as well. Anthonian inwards Fadeyi, looking good as well. Return journey, not bad at all. Ibejuleki, we did tell you it's good movement as well from Ibeju down to Eleko Junction, and of course from Eleko inwards Igondo, Oloja, as well as Bogije, Lakowe, Awuyaya down to areas like Abidjan. Steady movement this morning. Return journey also looking very, very good for now. Eleko Junction to Eleko inside, good. Likewise for Akodu General Hospital, and of course from Eleko inside Akodu General Hospital, proceeding through Lekki Free Zone, as well as Pinnacle Depot, Imibido, Danko Refinery, as well as Deep Sea Port, as well as Danko Fertilizer, very much in good shape. All those corridors, you're still having it good this wonderful morning. All right, then, do not forget, you can also join the conversation and ask any question that you want to ask the Prof in the studios that relates to your kidney. 080-99-120777. But you can try the number majorly. You can try this one, 091-5387-7127. Hello there, good morning.
Hello, good morning, Mr. Victor.
All right, what's your name?
Good morning.
Good morning. Hello?
Hello, can you hear me?
Okay, I can hear you now. Who am I speaking with?
My name is Duni.
Oh, Duni, how are you doing?
Fine, thank you.
Great. Where are you?
For yesterday.
Yeah, thank you.
I'm actually on a cold bridge.
Okay.
Yeah, I'm coming from Victoria Island, going back to Ikeja.
Okay.
And I observed that these Okada riders, in fact, they will cause a lot of havoc here on the bridge if the task force don't speak up, as in if they don't start doing something at the moment. And because I know that they're not allowed to fly this route.
That's true.
But there are just too many of them. And the irony of it is they're now facing one way. They almost hit this. I saw a woman now cleaning the road.
These two sweepers, yes.
Yes, one of the Loma
sweepers.
Yes. As a cost of trying to navigate and how would I say it?
Yeah.
I don't know where we'll be then, Mom. My times I just get confused because I don't know how somebody will be facing me coming on my own road.
I understand.
And trying to avoid me. And in the course of trying to avoid me, he almost hit that woman.
Wow.
So that's why I have to call now. It's high time. I don't know. Maybe all this tax force, they just leave them. And the same thing happened to when I was descending the same code bridge towards CMS.
Right.
I just saw that those Okadas were parked there just at the bottleneck of the bridge.
On the bridge. Wow.
Yes, picking up passengers and still facing one way, coming down to the mainland here.
Okay, I'm sure we're going to call on the task force chairman to do a kind of mop-up action there.
Start doing something before we now record another loss of life. Because all these sweepers too, their life matters. Oh.
That's true. All right. Duni, we've taken note of that. Thank you so much for bringing that to our attention. Of course, CSP, that's the CSP Jajalui. Please, you need to help us look into that. That's around Eco Bridge end. She's talked about so many motorbike riders always plying that corridor, driving against the flow of traffic. That shouldn't be needed. And I even forgot to ask her, Duni, about her attention to her kidneys. All right, so Duni, you can also send that in. Let me know. I hope you're paying attention to your kidney. 08099120777 09153877127. Prof, so let's get back to this. What diseases affect the kidneys?
Well, thank you. Quite a number of diseases, really. We'll look at the common diseases that affect the kidney. First is hypertension. Yes. The longer somebody has hypertension, the more likely that the kidneys are going to be affected.
Okay.
And the higher the values, so if the person is not taking his or her drugs, that person is liable to have a kidney disease.
Right. So hypertension here means high blood pressure?
High blood pressure. It's
okay.
One of the major causes of kidney disease worldwide. The second one is diabetes. That is, people have a lot of sugar in their blood and are not taking medications. The longer that stays in the body, the more likely that the person will have a kidney disease. Then
let's take this call. Hello there. Good morning.
Hello.
Good morning.
Good morning, sir.
All right. What's your name?
My name is Moses Sojibi.
Okay, Moses, you are echoing where you are. Maybe you can just move out a bit, but go ahead with your question.
My question is, what can smoking do with kidney?
Okay, smoking.
Yes.
Okay.
Do it have any effect with kidney?
With kidney. Moses, where are you calling from?
Calling from Ibafo, Ogun State.
Ibafo. All right, then. Thank you so much, Moses, for that question. Just listen on your radio. Professor will answer you. All right.
Okay.
All right. So, is there any effect of smoking on the kidney?
Yes, smoking does affect the kidney. Smoking is one of the things that we know can cause cancer, in the kidney and the collecting systems.
Okay.
And so it does have an effect. Smoking also predisposes to some what we call atherosclerosis. Don't bother about the longish name. It's it's a name that just says that a lot of fat gets deposited in your vessels.
Okay, so smoking can cause that.
Yeah, smoking is
In fact,
one of the risk factors.
It appears that smoking is a risk factor for most of the internal organs.
Yeah, lungs, heart, name it. So
all right. So one should quit it. Or can one do it small by small?
Better to quit.
Better to quit. Okay. Yeah. All right. So, well, you were just talking about some of the diseases, but let's take this call. Hello there. Hello.
Yeah. Good morning.
Good morning.
Yeah, my name is Mr. James. I'm calling from Yanoburu at the moment.
Hey, Mr. James. It's a long time I heard from you. How are you doing?
Yes, I'm fine. I want to ask the Prof. At times they will tell you need sugar, and at times they will tell you don't need sugar in your system. But I heard the Prof talking about sugar. Then secondly, how can you know if you have a kidney problem? That's orally. Start going for medical checkup. Is there any how you can feel it? Maybe like if you start feeling, or like a symptom.
Very good.
That your kidney is having an issue. Then thirdly, excessive alcohol, does it have any effect?
Good. Thank you so much.
I'll just listen from the radio.
All right, thank you. So 3 questions packed into one. Of course, Prof talked about excessive sugar, but we also know that sometimes they just say you need sugar. So how come excessive sugar now becomes a problem? Prof, can you just break this down for our people?
There's no time that you don't have some sugar in your blood because you eat and all the likes. But what I'm talking about is when the level of sugar in your blood becomes abnormally high, very high. And that's what we mean by diabetes.
Okay.
So it's abnormally high blood sugar.
But sometimes they don't say we should avoid it totally, sugar.
No, well, practically
for adults most of the time. Or is it that if you come from a diabetic family?
If you take food, and if you take carbohydrate, for instance, that gets broken down in your body to small sugars. So whatever you take, invariably, you still have some sugar. The avoidance is that you shouldn't take too much of refined
sugar.
So that
but you can take the natural sugars that we have in fruits.
You can take.
Okay. All right. Here's another question. You want to talk about symptoms? Are there ways they can know?
Yes, there are symptoms of kidney disease. If you notice that anytime you go to the toilet to urinate, you have a lot of foaminess in your urine. It foams as if you put omo or soap or whatever in your urine, and it foams a lot.
So that's showing a sign.
Yes, that you have a lot of protein leaking out of your urine.
Ooh.
And the other thing is if your legs are swollen, it could be from kidney disease. If you wake up in the morning and your face is swollen, that's another sign. If it's severe enough, you could be vomiting, persistently. You could lead to some issues with your not being able to concentrate, and at a very severe end of the spectrum.
Right. Let's take this call. Hello there. Good morning.
Hello.
Good morning. Yes.
Yeah, I heard you.
And
I heard you wanted to ask me something about my kidney. My kidney is fine. I hope so.
Have you gone for a test?
Yeah, I've not gone for a test, though, but at least to an extent, I know more about this kidney thing. I've had friends. I had 2 friends that actually undergo dialysis.
Okay.
And since then, I've been very careful. I take a lot of water, and I am watchful about whatever I eat.
Okay.
But what I want to ask the doctor today is, how much stress? Because I hear stress too can have effects on our kidney.
Okay.
Yeah. how much stress do you think, or should we be wary of to avoid having kidney? Because Lagos and Nigeria as a whole is full of stress. We are always stressed. No matter how much we try to watch our diet, but when it comes to stress, it's something that I wouldn't say it's unavoidable, but you can always manage it.
Exactly.
So is it only through sleep, or does it have to do with working with your brain when your brain is overworked? And does that affect the kidney as well?
Okay.
Or all we need to do is just keep away from shouting, like I've just done. So that's what I need to know.
Okay. All right. Dude, thank you so much for your contributions this morning. All right. So, can stress affect our kidneys?
That's a tough one.
Okay.
Because stress is very subjective. What the situation that you find stressful might just be a normal
thing for somebody else.
For somebody else.
Okay.
So it's something that is
it's relative.
Very relative. And so quantifying stress in the real terms of 1, 2, 3 scale,
it cannot be easily done.
A bit subjective.
But majorly it's about lifestyle, right?
Yes.
So let's talk about food now. So can the food I eat harm my kidneys?
Well, the food you eat can indirectly harm your kidneys.
How?
In that if you take a lot of unhealthy diet, full of cholesterol and all that,
okay,
you are liable to develop some atherosclerosis, as mentioned. Yeah, so being deposited in your vessels.
All right.
And the blood supply of the kidney can get affected
in that regard.
Yes.
Okay, let's see if we can take this call. Hello there, good morning.
Good morning, Mr. Victor.
All right, this is Dr. Busari.
Yeah, this is Dr. Busari. Thank you very much.
Nice to hear from you.
Oh, thank you very much. Good morning to the Prof. I want to ask, somebody that has donated one of his kidneys, that means that person is left with one kidney. So how long can that person live? At least provided he or she does everything that she's asked, she complies with whatever she's asked to do. Thank you very much.
Okay, thank you very much. So, people donating one kidney, living on one kidney, you did say they can still live. So, but let's confirm this now for Dr. Busari. How long can the person still live?
Well, thank you, Dr. Busari. That's a very important and relevant question. I made mention that some people are born with just one kidney and they live, pretty much to their old age without any issue. And so donating a kidney doesn't reduce the lifespan
of anybody. Okay.
But I must also say that if you compare people who have donated their kidneys with the general population, those who have donated their kidneys may have some kind of survival advantage, or that's
they live longer
in a way. But now we are not looking at. I will explain.
Explain quickly, Prof.
Because before you donate a kidney, we will have screened you properly
to be very sure
that you don't have any kidney disease or any disease at all that will affect your kidney, and that you are healthy, really, really healthy. So if a patient, for instance, brings in about 3-4 donors, so we pick the healthiest.
Okay.
And so it's select. I mean, those who donate their kidneys are selected. So they are healthy. They are the healthiest of
them all. All right, I have some questions that I would like you to answer in quick succession. Let me see if we can run this before we take any other call. Drugs that I take, can it affect my kidneys?
Yes, of course. The drugs that you take can affect your kidneys in several ways.
Let's talk about the youth these days, because there's a lot of indulgence. Some are using all sorts of drugs to enhance whatever kind of performance they think they're doing. Does that have any effect on their kidneys?
Yeah, it does. A lot. Because some of those drugs directly injure the kidney. So it's not unheard of for them to have kidney damage,
Okay.
from the drugs that they take. And not only that, apart from taking the drugs, they are engaged with a lot of social activities that are not optimal. So they are liable to contract HIV, for instance, because of their lifestyle.
Right. So let's talk about that now. Because a lot of times we see boys, we see lots of young men engaging it. They call it performance enhancing kind of drugs just to increase their libido, as the case may be. Prof, is that healthy? Is that good?
No, it's not healthy because at that age, it's something that they don't need.
You mean it?
Yes.
Some feel some are married. I'm talking of even those that are married and they feel they're not performing so well in the other room, and they feel the only way they can, show up their confidence is just to go for these substance enhancing kind of drugs.
Yeah, I would advise that they see their doctors, and the doctor would, examine them.
Okay.
And find out why they are not performing.
So the doctor can provide a remedy?
Yes,
Okay.
I believe so.
Are there suitable alternatives that they can use rather than going for the ones on the streets?
Well, I've said it. Get advice from your doctor.
Okay. All right. Can a human being survive on one kidney? I think you've answered that.
I've answered that.
All right. So what can I do to improve the health of my kidneys?
Yeah, I think that is the crux of
the matter here.
the matter here.
All right. So what can one do?
So really, you need to go for regular checkups. If you're above 40, especially.
All right.
And if you have certain conditions, like if you're hypertensive, that's if you have hypertension or diabetes, or known to have, diseases such as sickle cell, or some infections such as HIV, hepatitis, I've mentioned diabetes, which is quite. If you are elderly and you have prostate, you're liable to have a large prostate, so you need to have your kidney function checked
All the time.
Oh.
How often should I go for a kidney test?
On the average, maybe yearly. If you don't have existing kidney disease.
All right. Someone should go once in a year at
Yes,
least.
and,
All right. So what tests can one do that connects to the kidney? If I go to the lab now, for instance, what kind of test will I request for?
Well, the lab will take your urine and will check the urine for protein and also for blood. So if you have protein in your urine, it signifies kidney damage or kidney injury. And so the urine will be tested. Then blood samples will be taken. So
Right.
look for the waste products.
Okay. All right. We have to take this home now because of time constraints, Prof. So what's your advice, people, even as we mark World Kidney Day? What's the message?
Well, thank you very much, Mr. Victor. The message is that kidney disease is common, potentially harmful, but it's treatable. And so I'll advise our listeners to get tested. So go to the hospital, do your test, and also avoid all these things we've been talking about over the past 30 minutes or
Right.
about.
Okay, then we'll leave it at that for now. Prof, nice having you in the building. Thank you so much for being here. I do appreciate you. Thank you so much, sir.
It's a pleasure.
Okay, at very short notice, Professor Jacob Olugbengba Awobusuyi was here, and he's been able to take us through the excursion this morning as we reflected on World Kidney Day. So you've heard most of the tips that he has given. Let's try to adjust so that we can, drop down those figures and understand that we're having increased cases of kidney diseases across town, so we have to do our own bit to reduce that. We have to go. The program has been produced by Temidayo Anthony, Favor Adeyemi in the building, and of course, our care is of the social media unit. Our executive producer is Tayo Akonle. My name is Victor Oteri. I'll be back shortly for the benchmark.